This is a video review of my course, Instrument-Assisted Soft Tissue Mobilization Utilizing Dynamic Extension Technique. Traditionally, IASTM treatments are very irritating to the tissues. By combining dynamic extension technique, you'll be able to get in deeper into the tissue with less discomfort. So it helps as far as that irritating process with IASTM. Traditionally, IASTM instruments can be made of jade, bone, plastic, stainless steel, a variety of different materials, and some have advantages, disadvantages. Also, the design of the instruments will also be helpful as far as comfort as well as being able to help with the effectiveness of the treatment.
This video is a brief demonstration on instrument-assisted soft tissue manipulation. We're going to be using a steel tool, however, it's got specialized beveled edges which really make it ideal for this type of treatment. First, we're going to start by applying some emollient, which is simply lotion, just so we don't disrupt or irritate the skin. We don't want to irritate it too much, cause unnecessary pain or discomfort. So once the emollient is on there, we're going to start working around, for this video, the lateral epicondyle to treat lateral epicondylitis or tennis elbow. So we're going to be working on the underlying tissues, the fascia, the muscles, the tendons, and whatnot. What we want to do here is we actually want to irritate the area just a little bit. A small amount of irritation, a very good thing. It's when we have a lot, it's a bad thing. A little bit of irritation it promotes proper tissue repair, proper healing, so that's the outcome that we're after. You can see there's a small amount of redness, that's completely fine. It's actually kind of a good sign because blood is now coming to the area, rushing there, it's going to start to promote the healing process. So the treatment is typically brief. The entire treatment lasts no more than 2 minutes. So that's going to conclude this brief demonstration for lateral epicondylitis.
IASTM treatments are said to have evolved from gua sha. However, gua sha was not used to treat musculoskeletal conditions, but was traditionally applied along meridians to move bad qi out through the skin, also to combat pain, common colds, heat stroke, respiratory problems, and a variety of different health issues. The one thing with gua sha is that as you can see, it's very aggressive.
We saw Jessie, who's your demo, patient here, and hers is a success story from you. I mean, she's come many times to your clinic for acupuncture as well, and for these, techniques that you've had. Now, you used it on the back, and you're basically pulling out the stagnant blood.
Yeah. Right? So in addition to the needles, people think of acupuncture as just the needles. There are these other modalities. One is known as gua sha, sometimes pronounced gua sa. And it's basically using a smooth edge tool to repeatedly press and stroke the skin. It's not breaking the skin at all. It's just pressing and stroking the skin repeatedly. And what it does, as you just mentioned, is brings up stagnant blood and lymph from the superficial fascia.
So you see that red skin getting red.
Exactly. So the skin gets red, the blood comes to the surface, and what that does is increases cellular turnover. New cells get born more quickly. Fresh blood comes to the area.
So how do you remove the stagnant blood from there?
It gets turned over. It's like, because it's no longer deeper, it comes to the surface of the body, so that stimulates the immune system, and the body's like, hey, we need to deal with this. Turn it over, new fresh blood and energy to
And
that
is
area.
it on the spine, only the upper spine, or
It can-
anywhere?
it can be used on various
see.
parts of the body.
But then
It's
how do you pick and choose the area?
Well, it's so it can be used if someone's immune system is low, if someone has a cold. It can be used, commonly used actually throughout East Asia and Southeast Asia. Families use it. Parents do it on their children when they get a cold or a flu.
see.
All kinds of respiratory ailments, actually even digestive ailments, depending on where you do it, which part of the back
meridians.
you address.
Okay.
Exactly. So say someone had a chronic stomach issue and it seemed like there was something really stuck in their actual stomach. I would go to the part of the back where the points that correspond to the stomach relate to, and do it on that area. And it actually also corresponds to the nerves that come out of that spine at that area that innervate those organs.
Eastern scientific data exist for the amazing properties of gua sha with anti-inflammatory effects on a variety of different conditions. But as far as Western philosophy medicine, studies done in China are still subject to skepticism by some clinicians unless repeated in the West. This important data hopefully will be studied in the U.S., but it's slow in coming. Another offshoot of gua sha was coining. If a gua sha tool was not available, people would find a well-worn coin to provide the treatment.
Hi, this is Yasuko and it's time for Massage Monday. This week I'll introduce you to coining, which is an ancient Chinese method of healing. It is also called scraping or gua sha in Chinese. You rub your skin away from the heart with a coin or something else to bring up the toxins to the surface. You can do this sitting or lying. Here my friends are doing the coining session. My friend uses tiger balm for the gliding and its healing agents, and the lid of the tiger balm jar, which doesn't have the ridges and smoother than the coin. You can also use a spoon. Darker color means more toxins. You have a lot of toxins.
I know.
That's just not too bad.
Really?
Yeah.
You've seen worse.
Yes, I've seen worse. This is just red. I've seen purple, you know?
Really?
Actually, 10 days ago, I was purple.
Yeah. Hey.
The receiver had a cold and was very weak, but she gained so much energy after this coining session. So I had it done too. Even my spine had toxins too. Some parts were sensitive, but it did not hurt as it looks. Right after the session, you have a dull moment, which is typical of getting a massage. Then it was like waking up the back with new energy. It varies by person, but my bruising went away in 3 days. The only bad part about this is that it looks ugly and it looks like you've been abused at home. For that reason, I do not recommend having this done one day before you go on a date. Also, be careful doing this to your kids because you may get reported for a possible child abuse. Thanks for watching. I'll see you back next week. Make it a great week.
And yes, gua sha has found its way in modern beauty practices, a way of exfoliating and also removing superficial wrinkles. The most well-known Western IASTM treatment is the Graston technique. The Graston technique instruments are made of stainless steel. They fit very well into the hand, a variety of different edges and bevels. More than 15,000 clinicians worldwide practice the Graston technique. These clinicians are generally made up of chiropractors, physical therapists, and athletic trainers. Practitioners must be licensed by the parent corporation in order to use the Graston technique trademark or the patented stainless steel instruments. As you can see in this demonstration, Graston is very effective, but even with lubrication, it still is somewhat irritating to the skin.
Hi, my name is Dr. Josh Bross, and I'm a chiropractor here at Omega Rehab and Sport. We're going to do a quick demonstration here with Davey today about a technique, Graston technique and active release technique. Davey is a former baseball player, and he's had shoulder problems for about 6 years now. I've already done an exam on him. He's got a little bit of an impingement with a little bit of lack of range of motion in his right shoulder. So we're going to sort of go through it and show you how we fix these problems. So one of the things Davey's having issues with is horizontal adduction. And so go ahead, Davey, show your right arm here. And he's pretty limited. He feels a little bit of pinching up here and a little bit of tightness to the back of his shoulder. And now do the left arm. And the left arm, you can see he's got quite a bit more range of motion. So we're going to work on this and see if we can correct it right now. Pardon me. So these tools I'm using are called Graston technique. And it's a great way to treat soft tissue injuries. So the first thing I'm going to do is I'm working a little bit of the supraspinatus part of the rotator cuff, and just looking for adhesions or scar tissue in the muscle that may limit a little bit of his range of motion and account for some of the pinching he's feeling. So we're going to do a pretty abbreviated version of this just for the time's sake. And you can see what happens was you get a histamine reaction in the skin, which is basically the skin gets nice and red, the blood vessels release histamine, so you have increased blood flow in the area. So we're going to just do this a little bit, and you can see he's got a little bit of petechiae, which is basically scar tissue being broken up underneath the skin there. So you can actually see the scar tissue being broken up as we go. Do a little bit more here. Okay. Now what we're going to do is we're going to have Davey go through the range of motion that is actually restricted, and we're going to do soft tissue while he's doing the range of motion. So go ahead, Davey. So I'm going to have him just pull his arm across, and I'm actually working the posterior capsule of the shoulder to try to free up any scar tissue, any adhesions, to try to increase his range of motion. And back, Davey. And forward again. And so what I'm doing is I'm trying to feel, keep going. I'm trying to feel for any changes in tissue texture, any adhesions, any scar tissue, any abnormalities basically as I go. I'm going to change my direction here as I go. You can see there's a little bit of scar tissue right here that we're finding. And you can see the red marks. Good. Let's do 2 more. Okay, good. Last one. Again. Okay, perfect. Okay. Now the next muscle we're going to do is we're going to work a little bit of the rhomboids, which are back here, and they possibly could account for some of the lack of range of motion in the shoulder. So Davey, go ahead and do that same motion again. So we're just going to work these muscles as he's moving his arm back and forth. And again, you can see a little bit of the red spots right there, little petechiae coming up already. So he definitely has some soft tissue restrictions going on, and we'll see if these account for his lack of range of motion in his shoulder. Just one more, Davey. Okay, great. Alright, and last thing we're going to do now is we're going to use a technique called active release. Davey, go ahead and lie on your back. And so one of the things I found was he definitely had a little bit of adhesions in his subscapularis, which is deep in his armpit right here. And the subscapularis is a vital muscle for shoulder function. It helps control the humerus as you raise your arm up and bring it back down. So it's not the most comfortable technique right here in the armpit. We usually get pretty quick resolution of symptoms. You doing okay, Davey?
Just great.
Good. So I'm definitely finding a couple of adhesions here in the muscle, and he can feel them as well, I'm sure. A couple more. There's another one right there. Good, and last one. Okay, great. All right, Dave, let's have you sit up. And okay, so now what I want you to do is just move your arm around first and tell me how it feels.
Feels good.
Feels good?
Yeah.
Okay, now bring it across your chest. Let's see how... Wow, that's huge.
Yeah, exactly.
Your elbow's now past your head, past your face where it was prior before it.
Yeah.
Good, now do the left one. Let's compare. They're pretty similar right now.
Yeah.
So good. So there's an example basically of how using soft tissue Graston technique, active release technique can resolve a shoulder problem really quickly. That's it. Thanks.
The promoters of the Graston technique claim that the instruments are much like tuning forks, as they reportedly resonate in the clinician's hands, allowing the clinician to isolate adhesions and restrictions and treat them very precisely. The promoters of Graston also claim that the metal surfaces of the instruments do not compress the tissue, as do the fat pads of the finger, so the deeper restrictions can be assessed and treated. Clinicians that I speak to that use the Graston, they feel they're far superior because of the weight of the metal as well as the ease in holding the instrument. Very comfortable. There is such a wide variety of IASTM instruments or tools out in the marketplace today. So what I tried to do was to compare the more recent or the most popular to find out if there was any kind of common denominator as far as shapes, types of materials that are used. And what I found was that it's so diverse. Some offer training courses, some do not. The prices can go all the way from a few dollars all the way up to thousands of dollars. And another interesting thing is that some practitioners are able to use the instruments to where others are not. Also, with most instruments that I reviewed, I found a lack of scientific evidence as to the effectiveness of a particular treatment over others. Another well-known instrument is IASTM. IASTM is in plastic as opposed to stainless steel.
The IASTM system is an innovative form of soft tissue therapy that stimulates the body to produce healthy tissue in areas that are causing problems. When you receive IASTM treatment, a certified clinician will run specialized instruments along the surface of your skin to identify and stimulate the areas of dysfunction. The body responds to this action by producing healthy tissue in the injured area, which will enable you to return to pain-free activity. Scientifically developed protocol calls for precise application of this hands-on treatment and ensures exceptional results, even for chronic problems. The IASTM system then includes a customized stretching and strengthening program specifically designed to encourage your body to heal correctly. Activity that supports healing of the dysfunctional area is actually required, helping you to get stronger and preventing recurrence of injury. IASTM treatment can be used throughout the body for injuries such as chronic tennis elbow, carpal tunnel syndrome, patellar tendinosis, plantar fasciopathy, and non-radicular back pain. Years of careful clinical research and thousands of healed patients prove that most problems treated with the IASTM system will resolve within 6 to 9 visits to your certified clinician. IASTM treatment is innovative, proven, and really works. For more information or to locate a provider, call 1-800-333-0244 or visit the Locate a Provider section of the IASTM website.
I also found it interesting how the Graston technique and the IASTM training gears their courses to particular professionals. With the Graston technique, it's primarily for physical therapists, occupational therapists, chiropractors, certified athletic trainers, medical physicians of many different types, selected Canadian registered massage therapists, naturopaths, and acupuncturists, to where the IASTM training also will gear their educational and certification to those groups, but they don't feel that chiropractors would be in that group of training. Adhesion breakers are stainless steel instruments, and they are said to be the same type of quality of the Graston tools, but at a much lower price. There's also no certification courses required or any restrictions as far as which practitioner can use these instruments and which cannot. Zuka tools, which are also stainless, they come with a nice hard carrying case. They are said to fit into the hand very well. They're very comfortable and easy to use. There's no certification, licensing fees, or restrictions as far as use. The next is Hawk grips. With Hawk grips, stainless steel instruments, training courses are restricted to athletic trainers, physical therapist assistants, occupational therapist assistants, and massage therapists. With Hawk grips, really interesting looking tools. They seem to be very reminiscent of the Graston tools, and then you look at the price and I go, oh my goodness, and they're gold. How cool is that? The M2 T-Blade. This is a unique looking instrument. It's said designed for both left and right-handed practitioners. 8 distinct treatment points with a total of 14 edges all in one tool. Stainless steel and no restrictions as far as who can use this, and they do offer a discounted price if you take their instructional course as well. The Edge Mobility Tool. This unique instrument is available in either stainless steel and also plastic. And the prices are definitely considerably cheaper than the other instruments. The Rock Tape people have recently just introduced rock blades. Rock blades consist of one tool which is stainless steel and the other tool which is plastic. With the instruments that I have showcased so far, each having advantages, disadvantages over the others, I was looking at the actual modality itself. Would it be possible to achieve the same benefits by using other types of instruments that we might be able to find around the house, not used traditionally as a therapeutic tool? With dynamic extension technique, which I've been using for many years to help people with lack of awareness of their body to be able to treat the tissue deeper with less discomfort. And I thought about the properties of IASTM and its irritating nature to where it seemed to be a perfect fit with dynamic extension technique.
A million different techniques you could use in modalities. Myofascial release, neuromuscular therapy, strain counter-strain, reciprocal inhibition, muscle energy technique, active release technique. The list just goes on and on. My contribution to all of this is what I like to call dynamic extension, because it combines the best out of all of them. If you were to look at working with people, what's the number one problem that I face more than anything? Is their lack of awareness of their body. When you touch them, they just jump. With professional athletes, they are like known for pushing past their pain barrier so much. The more that you push past your pain barrier, you become desensitized. The more desensitized you are, the hypersensitive you are. And then we get on the table and they just jump. So how can we increase a person's awareness of their body that they might have lost? Making it easier on ourselves, and all of a sudden I started putting all of these together. If they have the available range of motion of bringing their ankle off the edge of the table, then if I were to, what's the exact opposite muscle of gastrocnemius, which is tibialis anterior in the front? If I were to tap on tibialis anterior, that tells her to contract that muscle. And when she does, that's going to dorsiflex her ankle. And it's going to stretch the gastrocnemius. The nerve signal is going to the front because it has to contract and shorten that muscle, activate the muscle. So neurologically, the nerve signal is going to the front, and it allows the back to let go. This is the process of reciprocal inhibition. I could push on this baby all day long with all the pressure I want, and it's not going to cramp, as long as she's activating the front. So now if you could do this, but do it really slow, do it super slow. And as she's doing that, that's what I'm going to be stroking it. The nerve signal is going to the front, not the back. And then relax. And then again, let me make sure that you're centered on the table. Gets in there, doesn't it?
Mm-hmm. That's where we get a lot of our cramps when we jump out of bed.
Yeah.
Stand on it so that we can
Relax,
stretch.
and then again. And now for the most important reason to do dynamic extension. They're doing all the work. I'm just relaxed, eating my sandwich, reading my book. And it gets in there, doesn't it? It's increasing her awareness of this area she might have forgotten about. And if you want to take it up a notch, go against the grain while they're doing dynamic extension. So outside portion, and then dorsiflex your ankle. Is that okay? It's getting in there, isn't it?
Oh, yeah, it is.
Uncomfortable, but never painful. Relaxed, and again. Doing okay?
Mm-hmm.
Let's try the inside one. And then dorsiflex again. Is that okay?
Yep.
Go against the grain. If you find any speed bumps, then go through them instead of bouncing off of them. Those are adhesions of the fibers. And it's like you don't have to spend all day on this. This is like so different now compared to when we first started.
Dynamic extension technique works with the premise of reciprocal inhibition. So first we need to determine the action of the target muscle, or the agonist. Next is to find the opposite muscle, determine the action of this antagonist. Demonstrate to the person how to shorten or contract the antagonistic muscle. Have the person practice shortening the antagonistic muscle a few times slowly, which helps to increase their awareness and is helping to stretch out the target muscle. As the person continues to shorten the antagonistic muscle, slowly glide with or against the grain of the target muscle. With each stroke, as the tissue releases, more pressure should be able to be tolerated. In this demonstration, I'll be targeting gastrocnemius, which plantar flexes the foot, so that's the agonist. The antagonist is tibialis anterior, which dorsiflexes the foot as well as extensor digitorum. The instrument I chose to use in this demonstration is a piece of marble trim, which I found at a building supply store.
So if he keeps doing this on his own, he's becoming more aware of this area. He's feeling this stretch, even though it might be injured. He's taken it to its fullest range. Also be aware of how far he can go. Maybe if they're really injured, they can't go half as far. So from here, instead of just using this, I'm going to try and save my hand as much as I can. So for me, the best tool I'm going to have is my forearm. So then when he contracts again, nice and slow, that's when I'm going to be doing a stroke. Is that okay?
Mm-hmm.
And then relax, and then again. So you want to time it just right. Because if he were to be going the other way, it's not going to be helping. It's actually going to be a little more uncomfortable. So now we can also go against the grain, do it again nice and slow. Relaxed and again. And if he doesn't mind, I'm just going to just relax here because it's been a long day. And 9 times out of 10, they don't mind if you're sitting on the edge of the table, right? Because they want results. Could go the other way, relax. Not too bad. And then we'll try the inside medial part. Okay, again. A little bit more uncomfortable.
What does it feel like, Steve?
Feels good.
Okay, again. And they get tired of doing this. They go, can't I just lay here and relax? No. That's not what this is about. And again. Dynamic extension. This works great. It's the best muscle to demo because the leg is supported by the table. And you don't have to worry about anything. So this is a concentric contraction. This is an eccentric. This is the agonist. And this is the antagonist. So then, okay, do it again. Feel different? So that was kind of, I covered about this much space. What if I were to try a smaller stroke? Try it again. What was that like compared to the other one? About the same?
No, they were different. It just felt like you just kept going deeper and deeper into that smaller space. Like I could feel it releasing multiple layers each time.
Mm-hmm. As opposed to if you were to just stay still, don't do anything. Do you feel the difference?
Yes.
Isn't that something?
Yeah.
So dynamic extension will make your work easier. All you have to do, there's a little bit of mind stuff, so you have to kind of figure out which is the concentric and which is eccentric. And then you have to figure out how am I going to get them into that position to do that. Then once you do that, it's no problem. Then all you have to do is just make it easier on yourself. How can I do this so I'm not straining myself when I'm doing this? So we have to be a little creative as far as that goes.
So you're mostly just working the eccentric side on this?
Yes.
In this demonstration, I will be treating flexor digitorum, longus and brevis, which helps to flex the toes, which is the agonist, as well as the plantar fascia. The antagonist muscles are extensor digitorum, longus, and brevis, which extends the toes, and also tibialis anterior helps with dorsiflexing of the foot. The instruments that I chose for this demonstration would be a nice large beveled spoon, which is traditional flatware, also an Asian wonton spoon, which also works very well as a wall plate that I found just to give has a nice bevel to it, and also a small butter knife.
Okay, so with this, if I wanted to work this area, then I need to have him contract the opposite area. So the opposite area is the top, which is extensor digitorum. So if he can extend his toes, and you might have to show him what you want them to do, that's going to stretch the plantar fascia. So adjust your toes. Okay, so do that yourself. Now if you can, add a little bit of extra of tibialis anterior. So your extending your toes and you're dorsiflexing your ankle. Relax. So go back like that and then do it again. Flex your toes and dorsiflex. Do that a few times. So different positions for this for the therapist could be like this. You could use this. I know that was Irene's favorite, was using elbow. It's not as easy, especially in a position like this. You could also add a little bit of resistance. So as he's extending his toes and he's dorsiflexing his ankle, I'm going to resist that. Okay, relax. And then again. So he's pushing down and pushing back this way. Relax. And that will give you a different level of depth when you're getting in there. Is that okay? Not wearing you out? Okay. It's not great because I'm not positioned myself well. I'm off balance. I can't regulate my pressure very well. Ooh, let's try a spoon.
What's your favorite?
Spoon. Okay, so now again, extend, relax. Again. Ooh, is that gritty in there? Go ahead. Now you know how would you describe that?
Like a gravel road.
Was it totally uncomfortable?
It's not totally uncomfortable. I can tell you're getting in there.
Okay, let's try it a different way. Let's try it with this. Don't do anything. How does that feel?
It's good until you hit the bottom.
Doesn't feel good, does it?
No.
It feels so much better if you use dynamic extension. Especially on that area. And it could be the small spreader. Is that what we decided this is, a spreader?
Yeah.
Or we could use the spoon. And I think I'll give him a little bit of resistance. So remember, extend, dorsiflex. And I'll give you a little resistance. Relax again. Feel okay?
Yeah, it's intense.
It's intense. Like too much? I'm right on the edge?
Yeah.
Wow.
Like my toes don't want to flex once you're... Yeah. Oh, that was better.
I'm using a lot of pressure, but it's not that bad, is it?
No.
It looks painful for me. That looks great.
Now, after a few times of that, notice that I'm not doing this longer than a few seconds?
Yeah.
And that's interesting with that spoon. I had more positive results.
Yeah.
Don't look.
Don't look.
It's better not to know what tool you're
It's
using.
the saw, isn't it?
You got the big gun.
So with this one, you can go like that, but I really want to find a tool that I can get into this edge because this is a thick part of the plantar fascia and this is here, the ridge.
What is the spreader working there? Because it says it's not blade.
Or the edge of the spreader.
Yeah.
Probably. What about like the blunt end? Is that what you're talking about?
That's what I'm thinking.
So the blunt end will really get in, oops, sorry. Will really get in here. Okay, so extend your toes, dorsiflex your foot. There you go. Relax, then again. Relax, then again. Most plantar fascia problems is right here, not down here. And how much strain is there on me? Almost nothing.
I'm happy for you, Gary.
Thank you.
Gary, what do you do about...
The next demonstration is hamstrings. The antagonistic muscle is quadriceps, which helps to straighten the bent knee. I also found by elevating the ankle with a cushion, which is also shortening the hamstring a little bit, will be a better action. And you'll also receive a better release of the tissue. But also be sure to try and keep the person's knee in contact with the treatment table at all times. The instruments I used in this demonstration are a cake server as well as marble trim piece.
Okay, so dynamic extension of hamstrings. The job of the hamstrings really does two things. Because it attaches here at the ischium, it helps to extend the leg as well as flex the knee. The primary action, which I do, because so many muscles have multiple actions, I look at the primary action. The primary action of hamstrings is to bend the knee. So the opposite muscle of the hamstrings are the quadriceps. So how can we contract her quadriceps? Because she can't go past this way, because then she would be like superhuman. So how are we going to do that? So you can't allow her to do this unless you could maybe bring her leg off the edge of the table. But what I found that if you can elevate the ankle, that's going to put just a little bit of a tension on the hamstrings. So now if you could, take your shin and slowly push into the table and try and squeeze that ball, that circle. Try and make sure that you try not to bring your knee off of the table if you can. So go up to that point, okay?
Oh, okay.
Can you feel your quadriceps contracting as you're doing that?
Yes.
Because that's the job of quadriceps, is to straighten the bent knee. That's what they do. So now what she's doing is that she's becoming aware of her hamstrings. They are lengthening whenever this shortens. Okay? And then one more time, relax. Okay, so now if you would, slowly push your foot into the table. And as she does that, that's when I'm going to be doing dynamic extension. Doing okay? Uncomfortable but not painful. Every time she does that, that's when I do the stroke. You have to coordinate the timing of that. Okay, again. Going against the grain works really well with hamstrings. So go medial, so okay, push down again. But if you notice, I'm just using my body weight. And again. The inside edge is where you're going to find most of the issue. This will actually help to relieve that adhesion of semitendinosis. Okay, again, push down. Pressure okay? And then again. So I just go to like the tissue barrier to where I don't feel I can sink anymore, and I don't push it. Because I make sure that every time I do the stroke, I'm going to use a little bit more pressure. I'd rather slowly work my way in there instead of trying to go too deep, too quick. Again. In some cases, you'll find more of a adhesion or scar tissue at the common hamstring tendon. That's where all three hamstrings meet, so you might need a little bit extra cross-fiber friction there.
What does it feel like?
Fantastic.
Okay, a little bit more restricted.
So getting in there like that.
Can you feel it in it working through the fibers, or
Yeah,
just
so-
the pressure, or what?
I wasn't aware that that was sort of, I don't know, would you say it was hypertonic or not, but as he's going through it, I can feel it relaxing more and more. So yeah, after you pointed out, okay, it was very, very tight.
Okay, again, push down into the table. How's that feel?
Right.
Now don't push into the table. Any difference?
Yeah. So when I don't push into the table, it feels, it's not as deep, it feels more superficial, like you're getting, you know,
Okay.
top layers.
So when you're going over the hamstrings, with some people you're going to feel all kinds of different things. You might feel a grittiness, you might feel bubbles, you might feel, it just doesn't feel consistent. Amazingly enough, just by doing, okay again, push down. Just by doing a few strokes with IASTM, all of a sudden you'll feel that again and it's going to be like, oh my goodness, that is so different. What a distinctive change that you feel. Now, is it actually releasing the fascia? Maybe not. But it certainly is helping to remodel scar tissue, and it's also helping the subcutaneous layers with all of the extra gunk and fluid that's kind of become stagnated and built up, and it just pushes it right out. And it's like, especially if you're tired at the end of the day, you've had a long day, and you've got a large person that you have to work on, you have to really give it to them, really you should try this if you can. So dynamic extension really helps. If I were to just have her leg off the edge of the table and have her push into the table, let's try that. So how does that feel? Instead of pushing into the cushion. Do you notice any difference?
I do, not as effective, definitely not deep enough.
Good. That's nice what she said. She said it's not as effective. It's still effective, but it's not as effective.
With quadriceps, if the person is extending their knee off the side of the table, they have to tighten their quadriceps. So it's not a real true eccentric contraction to where they can stay relaxed. But it does seem to be effective for a lot of people that I ask about that. The alternative to that is to have the knee bent and have the person contract their hamstrings maybe about an inch. I also found in that instance that using just a little bit of resistance as the person moves will be even more effective. So if possible, maybe try both of those aspects. One with the knee extended and then one with the knee bent, maybe with a little bit of resistance. The instrument I used in this demonstration is a stainless cake server.
What we want to try and do is we want to create a concentric contraction with hamstrings, the opposite muscle, so this will relax eccentrically. So that would work really well if you just had them bend their knee. That's going to shorten this and it's going to lengthen this. Mm-hmm. But some of my constituents, I guess, would comment to me, well, if she has to hold her leg up, Gary, that's not a eccentric contraction. That's a concentric contraction. Then when she bends her knee, then, okay, fine. So with this, maybe we could try both ways. So if you could hold your leg up and then slowly bend your knee. Maybe not as well. Let me try my fork.
You want me to push the shorts up?
Maybe like Thanks. Okay, hold your leg up. Slowly bend your knee. Gets in there, doesn't it?
Yes, it does.
Do you feel
That's good.
pull around the knee at all?
No, not really around the knee.
And making sure to treat vastus lateralis because that's what gets all of the stress and shock. This area through here. So for those that would comment that, Gary, that's not to the truest sense of the word an eccentric contraction, okay. So what I'm going to do is I'm going to bend the knee, but I'm going to place my hand right here at the Achilles tendon. And I'm not, if you'll notice that her knee's not totally bent. It's just right here. So there's about an inch or two to go. So if I resist here, now bend your knee more. So she's only bending her knee about 1 inch to 2 inches. And I'm giving her a little bit of resistance. Okay? Again. Relax. And then again. So I'm resisting her as I'm going into it. A little bit tougher on me because I've got to resist her with one hand and push down with the other one. Okay, again.
So could you perhaps get one of the flex bands and wrap it
Yes,
around
flex
the leg
bands
so
work
that
well.
way you can pull?
So now with this one,
and
hold your
pull?
leg up and then slowly bend your knee. How does that feel compared to when I was resisting?
Definitely, there's.
Which is to the advantage? The resistance or no resistance?
Ooh, tough to say.
Do you notice any difference? There is a little bit of minor difference. Some people say when you do the resistance of 1 inch to 2 inches, well then it kind of, it's more of a true reciprocal inhibition. So there's less pressure.
Yeah,
But I was really getting these quads and they need it.
yeah.
So either way, but so you can decide which way you want to go. Do you want to have them hold the leg up and slowly bend their knee? Or do you want to get the leg down here and then resist about 1 inch or 2 and then have them bend their knee even more while you get in there with this? So you decide. Actually try both if you can. Okay, so if you would, do both hamstrings and then both quadriceps. Okay.
In this demonstration, we treated upper trapezius, the middle deltoid, posterior deltoid, and infraspinatus. The types of instruments I used in this, I experimented with a plastic type of paint scraper, as well as a house number, which seemed to fit very well into my hand. It was very ergonomic.
As we talked before, you feel it more in the front.
I feel it. Right now, it's all through here and then up through here.
So up through the traps as well as in through the front. And 9 times out of 10, it's usually because of this is too anteriorly rotated. So we need to try and get the person back like this. But just by working on that shoulder, it probably just isn't going to do it. So she also noticed a little bit of trap section, so the trap is pretty easy to figure out. Because if we need to work the upper trap, then we have to contract the opposite, which is the lower trap. So as she pushes her shoulder down, that's when I'm going to be working the trap. I also like, if I'm going to be working up here in the seated position with my forearm, I like to go this way. You're totally going against the grain. If you go this way, it's not as much. Totally against the grain going this way as she depresses her shoulder. Okay, so as far as this area here, the middle deltoid helps to abduct the arm. Where most of the problem is with that is just below the acromion. And those tools, those instruments are great for getting in there because you just wear your fingers out. You end up with arthritic joints, just like what I have. Use those tools when you get into here. It works great. So if the job helps to do this, the opposite is bringing it down. But then some people will say, well, Gary, it's not an actual eccentric contraction. Okay, fine. So just like with the knee. So by holding your arm up there and then slowly bringing it down. Is that okay? And then again. I'm going to go into a little bit of the posterior shoulder, which is kind of like the spine of the scapula again. Now there's a adhesion right here. And do it again, but do it nice and slow. In fact, let's just give you a little bit of resistance as you go down. Does it make it any different?
Yeah.
Better?
Yeah.
Or I could always do this. If she were laying on the table, face up, face down, doesn't matter. So now if we could, just have you scoot over to this side so we get more of the back of the shoulder. The job of infraspinatus helps to externally rotate the arm. Doesn't really, well, maybe it helps a little bit of extension, but its main job externally rotates. Internal rotation is a couple other different muscles, usually the pecs. So what we want to do is we want to stretch this one out. So with this one, if you could, internally rotate your arm, and then just to give you a little bit extra, adduct your arm across, or horizontally adduct. Okay, can you see how that's going to really stretch all this out and through here? Okay, so if we could, so internally rotate and then adduct. It's challenging because I'm kind of trying to brace her as I try and lean into her. So it's like, it's okay, but I'm not quite getting in there. But then all of a sudden, when we have a tool, it's a totally different story. So here's the acromion, so you want to be below that. Let me figure out which side of the tool. All right, let's try that. Okay, now do it. Oh my goodness, isn't that different?
Yeah.
Good thing we can't see her face. Okay, again. Isn't it? And I'm using less pressure than I was. It's easier on me.
Yeah.
I think we just found the purpose of this tool. How's it feel? Getting in there?
Yeah.
Okay, again. Did you, I don't know if you could see that, but there was like a speed bump right here that I went over.
I felt it earlier when I was
So if I go down like this, the speed bump kind of smooths out. If I go up like this, that's totally going against the grain. So what I'm going to do is I'm going to hook this tool just below that speed bump, and I want to stabilize her a little bit. Now do it again. We'll do it nice and slow, nice and slow.
Oh,
You see how slow I had to do that? Now, if that hadn't have been a real hypertonic or sensitive area, I probably wouldn't have done that. But didn't that seem to help that I was able to try and get through it
yeah.
instead of bouncing off of it?
Yeah.
Do you want me to do it again, or is that enough?
Oh, you can do it again.
Oh, you want to get my face this time? This is what you're supposed to look like when I'm right.
Wait, let me get a different tool.
That hurt? Yeah, I messed up my shoulder if I did something. Lifting over my head with a weight bar.
Let me position this correctly. Oh, she's really going to like this one. Okay, go.
So you're pulling away, but she's coming across.
Yes. And towards me. That really got in there.
Yeah, it did.
So just that alone, hopefully this will feel a little bit different.
This next area focuses on pectoralis major and also the rhomboids, utilizing the house number, which has a nice bevel on one side and a straighter edge on the other side.
Now with working the supporting structures of this, pectoralis major, the opposite of internal rotation is external rotation. So they could be laying face up on the table, they could be seated in a chair. So with pectoralis major, if I'm going to treat any of this area, I'm only going to be 1 to 2 inches below the clavicle. That's it. Nothing more than that. You can go against the grain like this. I usually just go kind of with the grain towards the sternum. So if you could slowly externally rotate your arm, maybe give her a little bit of resistance as she goes into extension. This is a nice area for forearm too, believe it or not. Nice and slow, nice and slow. A little bit easier. It's not as sharp as my fingers. So this is a job for a rounded edge. So a rounded edge, not flat. So with a rounded edge, now look how much less pressure I'm going to be using. Getting in there, isn't it? So I'm using at least 50% less pressure, and it's getting in there just as if I were doing this, isn't it? Isn't that something?
With that, I can actually feel it go down in there almost.
Did you really?
Yeah.
So you're with the rounded edge, you're mostly holding it in there as she's moving her arm.
Here, I'm pushing into the body first. Okay, now slowly externally rotate your arm, and then now slowly extend it. Pretty fibrous in there. You don't have to go fast at all. Nice and slow. Okay, again. As opposed to using tons of pressure with this or with this. And it's like, oh my goodness. Okay.
That's good.
I don't focus on rhomboids as much because the biggest problem with rhomboids is just off of the midline, just off of the spinous process. It's real fibrous in there. And just cross fiber frictioning back and forth is definitely the way to go on this. So cross fiber frictioning just off of the spinous process. And it could, I mean, it's ropey on some people. But if you can smooth some of those ropes out, all of a sudden they'll notice that their shoulders have more freedom and more range of motion. So one of the jobs of the rhomboids is to bring the scapulas together. What's the opposite of bringing the scapulas together? Rounding forward. So if you could come backwards like that, and then now round forward. Okay, again.
So you can do it with clothes on, but it's preferable than having...
Yeah, either one's fine. Yeah.
These next series of videos focus on the flexors of the forearm as well as the extensors of the forearm, utilizing the house number as well as the plastic scraper. Time did not allow to demonstrate these very important areas of the body, but I wanted to briefly just touch on them. The suboccipital muscles help to capital extend the head, so the opposite is capital flexion of the head, as well as cervical flexion. The erector muscles can be treated by flexing the spine forward, or you could also treat one side at a time because it helps to laterally flex the spine. With quadratus lumborum, it also laterally helps deflect the spine, and the opposite would be the other side of the body. I hope you enjoyed this presentation. If you have any questions or comments, please contact me at advancedmassageeducation.com. Thank you.